Thank you, Steph. To protect our most vulnerable from COVID-19, this past weekend, Peel Public Health and a team of physicians administered about 100 vaccines at a local long-term care home. It hits close to home for one doctor who lost his father to the virus less than 2 weeks ago. To share his personal story, I'm now joined by Dr. Sohal Goyal, a family physician and chair of the Mississauga Primary Care Network. Good morning to you, doctor.
Good morning, Melanie. Thank you for having me.
Thank you for joining. I think it's very important to share your story because, one, you at a professional level, obviously you are impacted by what you're seeing with COVID-19, but more importantly, on a personal level. So I want to extend my condolences about the loss of your father. Can you tell us a little bit about what this last month has been like for you as a physician and you as a son?
It's been a very difficult time, I think, for a lot of us, especially on the front lines. My father was admitted on October 30th for a non-COVID related condition, and he was about to be discharged on December 16th. And unfortunately, on December 14th, contracted COVID, and he became quite weak while he was on the COVID ward. And as you know, you can't visit if you're on the COVID ward. We were lucky in that he got discharged from the COVID ward on December 31st to the rehab unit. But unfortunately, he developed a secondary infection and passed away on January the 3rd.
So really, doctor, a matter of 2-3 weeks with this battle for you to say goodbye. I understand you were very close with your father. Can you tell us more about who he was and what he meant to your family?
Thank you so much. Your father, for most of us, your father is your hero. Your father is someone who always comes through no matter what. He was definitely the alpha male in our family. He was the type of person who could fix anything. He worked at General Motors in Windsor for 29 years. We moved him to Mississauga 2.5 years ago so that we could be closer to him. And, it is a big loss for our family. But there are so many other families going through something similar to what we've gone through.
Dr. Goyal, I understand that you had to say goodbye with a funeral service just last week. But within days after that, you did something very interesting. You've obviously been an integral part of public health with Peel, consulting with them as a family physician, doing primary care. You said, listen, I need to do more. So tell us a little bit about what you have done.
Yes, so his funeral was on Thursday. On Wednesday, there was a call out to local family physicians. Our primary care network had been recruiting family physicians and community doctors' names, and we had 250 doctors volunteer to work with public health to administer COVID-19 vaccines in long-term care homes. As you know, they are the most vulnerable. We have over 3,000 deaths in long-term care homes in Ontario. And many of these are preventable. So the opportunity came up where I could go in on Saturday, so that was 6 days after my father's death, to vaccinate that vulnerable population. And it was an amazing collaboration between Peel Public Health and our primary care network. And we had the opportunity to vaccinate 100 patients in their rooms. So you're going in room by room and vaccinating this vulnerable population.
What was that process like for you, I guess, on both levels, personally for you and professionally?
So on a personal level, I was definitely teary-eyed when we punctured that first vial. And I watched very closely as that needle went in, knowing that each one of these needles could save a life, as well as on a professional level. The vaccine, of course, has been developed, properly, quickly. It is what will help us. It is the light at the end of this dark tunnel. A lot of us are tired. I think the public is tired as well. And we're just around the corner now. We see that light, and I know that we can, with the vaccine, we can most likely go back to our normal lives, but it's still going to take a little bit of time.
We are expecting to hear from the province today about some numbers, which they call dire, and expected to hear more restrictions. If you could leave our viewers with one message, what would you say?
The province will talk about the increased numbers that are going to happen, but we're not going to lower transmission rates by increasing restrictions or imposing harsher measures. Really, we have to just follow the current guidelines. We need better compliance. we need to just have our own household. We shouldn't be seeing other people. What that means is you shouldn't go visit your brother or your parents. We need to just stay within our own household, unless you're single and you can go to one other household. So the current measures are the right thing to do, but we need better compliance with those current measures.
And Dr. Goyal, when we spoke yesterday, you told me you don't want another family to have to go through what you and your family have had to go through with the loss of your father. So hopefully people are listening and hearing your experience, both as a son, a family member, but also as a physician, because these are very strong words. Thank you very much for your time today, and please send our love to your entire family.
Thank you. I really appreciate it.
Thank you.
Stay safe.